All right, we know the cold has been uncomfortable for many of us, but for some folks, it can also be physically painful. So we're talking about flare-ups of joint pain and arthritis. Novant Health orthopedic surgeon Dr. Ryan Harrell joining us today. Thank you so much for coming in.
Thank you for having me here this morning.
Let's talk first about the reasons that you see joint pain specifically during the winter months.
Okay, yeah, there's definitely numerous reasons for joint pain. We can kind of break it down into overuse and injuries. Injuries would be like ligament tears, muscle strains, and then overuse is what I see most common in my office. That would be arthritis, with osteoarthritis being the most common. A lot of people think arthritis or osteoarthritis is a disease, but it's really just the wearing down of the cartilage. It happens with as we age and the cartilage starts to wear down. And I use the analogy that if you drive your car a lot, the tires are going to start to wear out. Eventually
True.
They become bald.
Yeah,
So,
that's a good point. And we were talking before about age being one of the factors. It seems like that just seems to be a culmination of things that affects your joints for sure. But you said overuse, one of the main reasons as well.
Yeah, and age is kind of just a number. I see people who have injuries early in age and they develop some post-traumatic arthritis or just the normal wear and tear from life.
Yeah, just depending on what you do through life, right? So what can folks do to alleviate some of that pain?
During the cold winter months, it seems to be worse. I see a lot of patients come in with increased pain. I think a lot of it has to do with normal mechanisms that happen in our body. Constriction of blood vessels, decrease the blood flow to our joints. The synovial fluid, which is kind of the cushioning and the lubrication in our joint, becomes a little bit thicker. And also, the inactivity during the winter also increases pain. So I think if patients can find ways to be active during the winter months. Also, mood has been shown to be a contributing factor to pain. So after joint replacement, we've seen that an increase in mood or affect has been linked to less pain after surgery.
How do you know at what point, you know, I've got pain myself a lot of the time in my joints. How do you know when it's time to come and see an orthopedic surgeon?
I say when over-the-counter medications, at-home remedies are no longer working. 2 would be if you're almost thinking about it on a daily basis. It's affecting your life. And 3 is really when it affects your activities of daily living. So a lot of people around here like to play pickleball or golf, and when they can no longer do that is when they come to see us. In the office, we have prescription medications, bracing, physical therapy, injections, and even some patients are candidates for surgery.
So a lot of options before you get to the point of surgery. Important thing, just pay attention to your body, right?
Yeah, listen to your body.
All right, thanks so much.
Thanks for having me. Yeah.